There's been a lot of agitation coming out of Nevada, especially from Las Vegas Mayor Carolyn Goodman, about reopening the Las Vegas economy and doing it now. Jim, you have been the head of MGM for a long time. How do you see this push toward reopening Las Vegas casinos, getting travel and tourism back up and running?
Well, thank you for having me, Contessa. We believe at the task force that we need to address the COVID crisis as both a public health crisis as well as an economic crisis. And so what we're doing at the task force is bringing in the public sector, healthcare professionals, and the private sector, because we believe that it's a bigger job than any one sector can tackle alone. And so we view this as, how do we help the most immediate need for Nevada, which is desperately needed PPE and testing, while laying the infrastructure for a sustainable economic recovery through the lens of public health. And so we're taking a very much of a business approach to this and making investments in Nevada and specifically in Las Vegas to safely reopen the economy.
All right, so the governor has said you're at phase 0 of a phased reopening. He says, 1, you need 14 consecutive days of declines in cases and hospitalizations. 2, you need to maintain hospital capacity. 3, that you need to protect the vulnerable populations. And he says, look, get used to social distancing because that's going to have to continue. The Nevada economy depends on crowds. You look at day clubs and nightclubs, packed restaurants, casino floors, the big shows out there. Not to mention, you've got the Raiders Stadium that's supposed to open this fall. How do you reopen the economy if you can't have crowds?
Well, that's a good question, Contessa. As you know, Las Vegas really depends upon travel and tourism, and that's the basis of human interaction. So how do we consume entertainment in a safe perspective from a public health standpoint? And that requires investment. We're not unused to change. 9/11 did not change travel. It certainly changed the way we traveled. And every crisis since that point in time, we've had to adapt to emerging technology, emerging crisis. And what we're going to do here is much along the same way.
So what is that emerging technology, Jim?
So what we'll do first...
What's the emerging technology that you're weighing now?
1, we're going to broad-based test, and we're standing up high-throughput labs in Nevada right now to a point where at University Medical Center, we'll be able to test 10 to 20,000 people a day just in Las Vegas, about 30,000 people a day in Nevada. The business partners, the people coming to town will need to know that should a surge occur, we have the ambient testing capacity. That's happening right now. Secondly, we need to work with companies around the world to take best practices and deploy them in Las Vegas. Not unlike after 9/11, a company such as Clear made the travel process more seamless. We're looking for that company and other companies to make the entertainment experience more seamless. Arenas, stadiums, nightclubs, day clubs. We've also reached out to international companies such as G42, which in turn has worked with Oxford Nanopore in the UK. They've worked with Argonne in Illinois, and they've worked with BGI in China to develop a network to create pathways to come into our venues in a safe and responsible way. We don't have the answers yet, all of them, but we're doing this very thoughtfully because we recognize Las Vegas as an entertainment destination and a leader. We need to lead the way forward to reopening the tourist economy.
Jim, this is Morgan. When I see stats like 350,000 people in Nevada have filed for unemployment, that it's the highest number in state history, economists coming out estimating that you could have a 25% jobless rate, are you having conversations not just with companies and potential partners, but with workers as well? And if so, what do residents in places like Las Vegas want to see happen?
That is our critical priority right now, in addition to the public health crisis. It's the economic devastation that is occurring in Las Vegas. And I ran a company, MGM, that had 50,000 people alone in that community. So we're working with the unions, the culinary union, and with the non-union employees to figure out how to safely reopen parts of the economy. It starts with broad-based testing, and we're making the investment to be able to test not just the grossly symptomatic cases today, but to do more thoughtful testing. We believe testing is an economic imperative, not just a public health response. So one is testing. Secondly is to develop the ways to reopen the casino industry. As you know, we're highly regulated. Gaming employees and customers are quite versed with opting in to security surveillance, to opt in to identification, to opt in to ID verification. And
Jim?
Public health is going to be part of those security measures that the gaming companies are starting to put together.